Skin to Skin, Bonding Mother and Newborn, a research proposal by Jessica Anderson, Amanda Grindstaff, and Dante Leonard. Our hypothesis for our study states the use of skin-to-skin contact immediately after birth will help newborns transition into stabilization. This is versus those that are unable to use skin-to-skin immediately after birth. So what exactly is skin-to-skin? It also is referred to as kangaroo care, and it is allowing the newborn to have immediate skin-to-skin contact with the mother after birth and during the hospital stay. Why is it important? Studies have shown that the immediate skin-to-skin contact has positive effects on heart rate, temperature, glucose, and feeding. It also has shown that it enhances mother and newborn bonding. So where did skin-to-skin originate? It was originally a process that was mainly being used for infants in the NICU to help with stabilization. The faster the baby stabilized, the faster the baby would go home. The proposal we made includes a quantitative study that will include questionnaires and a survey. We chose a quantitative study because it is a study that can be used to help focus on the effectiveness of an intervention. So who exactly are we including in the study? We would like a total of 50 to 100 women to participate. We will focus primarily on postpartum mothers and their newborn infants. We would require a healthy pregnancy that is at least 37 weeks gestation, and that the newborns be stable, not requiring any medical intervention or NICU stay. So why is this research important? What are the benefits of this study? It has shown that skin-to-skin contact affects stabilization of the newborn. That means heart rate, respiratory rate, body temperature, and blood glucose all stabilize quicker with skin-to-skin contact versus no skin-to-skin contact. Why is this important? Well, it benefits the departments by possibly having fewer NICU stays. The faster the newborn stabilizes, the faster they can go home with less complications. So how will we go about gaining permission to do this study? We would definitely need approval prior to the study from the leadership team and management of the unit we will be conducting the study. We would also need consent from all participants in the study, making sure to comply with HIPAA and the Institutional Review Board standards.
So where would this study take place? The study would take place at the Johnson City Medical Center as soon as we were able to get permission to do our study from the leadership team and from the management there. The Family Birthing Center within the medical center is where we would do our study. The birthing center there does what is called couplet care. Couplet care is where they try to leave the baby in the room with the parents as much as possible. And this helps to facilitate family bonding and support successful breastfeeding. It also helps to increase patient satisfaction. Parents always seem to be happier when they can actually be with their baby and their baby doesn't have to be away from them in the nursery or up in the NICU, and their family can also visit and spend more time with them and the baby and help them out a little bit. The birthing center there is focused on doing skin-to-skin contact as much as they can, and they also encourage breastfeeding. The nurses there help the mother or the parents to do skin-to-skin contact as much as they can. They're always there to help educate them on how to do it and what the benefits of it are, and they're always really well at helping with breastfeeding. The framework for our study would be revolved around Ramona Mercer's theory of maternal role attainment. Ramona Mercer was a registered nurse herself, and later on she became a nurse educator. Her theory was a theoretical theory that was used to help with parental bonding, which is why her theory would make the perfect framework for our study. Skin-to-skin helps to initiate parental bonding, and we would also use a conceptual map as part of our framework. This map would help to give a visual representation of the study and would help subjects of our study to better understand what our study was about and how the study would be performed. The sample of our study would include 50 to 100 participants. These participants would be pregnant women that are of at least 37 weeks gestation. The participants would be voluntary, they would not be compensated, and we would let them know that there would be no compensation for them being a part of the study prior to beginning our study. We would use convenience sampling as our method. Convenience sampling is a type of sampling that involves the sample being drawn from a part of the population that is close to hand. So those that are going to be a part of the sample would be close to hand because they would be patients of the Family Birthing Center. For data collection of the study, we will begin by using cardiac monitors. Cardiac monitors will help us to monitor the newborn infant's heart rate. Thermometers, we will obtain axillary body temperatures with the thermometer, and glucometers to obtain blood glucose levels. We will also use observational data, which is where we will observe the skin-to-skin contact between the mother and the newborn infant, and we'll be able to record our observations of how the skin-to-skin is going. We will be giving questionnaires out as part of our data collection prior to the study, and we will use the interval level of measurement. This type of measurement will help to determine the numerical equal distances between the variables being measured. And we'll use the independent t-test as part of our data collection too. The t-test will help us to see the outcomes of the study, and will prove that the outcomes of the study will show the difference between the two groups of subjects that we're going to use. And those would be parents that are using skin-to-skin contact and parents that are not using skin-to-skin contact. We will obtain approval for our study from the leadership team and the management of the Family Birthing Center. We will have consent forms that will be signed by the participants prior to our study. And we will be in compliance with HIPAA regulations and the Institutional Review Board. All of our participants will be assured that none of their personal information, including their name, birth date, none of that will be shared with anyone outside of the facility, and that all the information we obtain will be used strictly for the study.
So as we finish up our presentation, we want to know what you guys think. So what are your thoughts and opinions on the use of skin-to-skin? Do you think that more facilities should support it? And should it become standard protocol? These are just a few things to think about. We hope you enjoyed our presentation.